Well, welcome. Thank you for coming. I'm Amitabh Goel. I'm a pain management physician with the Sarasota Pain Relief Centers. I'm also a clinical assistant professor at my alma mater, University of Kansas School of Medicine, trained in pain medicine and physical medicine and rehabilitation. And before that, in my other life, I was an orthopedic surgeon in England. So I've been dealing with the spine in one fashion or the other for a long time. And I'm really excited to talk about this treatment option that we have for spinal stenosis, because I think this is an effective treatment for a very common problem for which we really had no solution. So a little bit about the spine. The spine is basically made up of bones. The round end is the front end. The pointy end is the back end, and you can feel the points in your back. We call this the spinous process. In the center, there is a hole through which part of the brain that we call the spinal cord travels down. And basically, the function of the bone is to protect the nerves because they're very delicate. The nerves are in a sac, and which is surrounded by fluid that we call the thecal sac. So basically, we have bone surrounding that sac, then we have fluid, and that protects the nerves inside of the spinal cord. So this is another view. So basically, this is the front end. This is the pointy end, the spinous process that we call it. In between the bones are these spacers that we call discs. And the best you think of them is like jelly-filled donuts. That's what they actually look like. And they act like shock absorbers between the bones. And they make these holes on the sides bigger through which the nerves come out so that these nerves don't get pinched. You know, like everything else, like when you buy a house and you have a thick carpet, you walk on it for 50 years, it gets rubbed down. So the same thing happens with these discs. They get rubbed down, they lose their height, which is a condition that we call spinal stenosis. Stenosis basically means narrowing. And that starts pinching the nerves, and the results of which you get pain in the back, in the buttocks, down the legs, weakness in the legs or the back. Easier cases or the early cases, you can treat them with injections or with medicines. The cases which are more severe, you require surgery, where you have fixed stenosis, symptoms don't get better. But there's this huge group of patients in between, and really we had no treatment options for them before. Superion or Vertiflex now provides an option for this group of patients who don't get better with injections or medicines and who either don't want surgery or they have medical problems that stop them from having surgery, or they feel they're not at the point where they want to go through a surgical process because their symptoms are not that bad enough. So what is Superion? Superion is basically a device that we implant between the spinous processes, and what it does is basically it acts as a support and it keeps it from extending by increasing the space there and stopping the symptoms of neurogenic claudication. The nice thing about this is it's done through a small incision. It is reversible. If it doesn't work, it's easy to take it out, and it doesn't stop any treatment options. If it doesn't work for the patient, you can take it out and the patient can go on to have surgery. Again, we basically put in a little spacer between the bones to make space for the nerves there, so there is no collapse there. So who are the people we sort of recommend this for? This is people who usually had the symptoms for 6 months. They've tried some kinds of conservative treatment, could be non-steroidals, physical therapy, epidurals, and they want something else to help them with the symptoms, but are not prepared to go through surgery or are not surgical candidates. But the key thing here is that these are patients whose symptoms should get better when they lean forward or when they sit. The procedure is basically done through a thumbnail size incision, and it is, we put in a small instrument, we put in some small instruments, we dilate the space, and the nice thing is we measure the space, we can put in an implant that is suited to the size. So it's not like one size fits all. We have a different sizes of implants. We measure the size. So each patient gets an implant that is sort of measured or tailored to their size. We close the surgical site. It's typically not a big procedure. There's no blood loss. Most of the time, they don't even require general anesthesia. We can just give them some intravenous sedation and they're okay. This is the fluid sac that's around the spinal cord. These are the discs, these are the bones, and you can see there is a lot of space. So you can see the water column very nicely. But as you go down, lower down, the discs are bulging, there are bony spurs here, and there's hardly any water to be seen. Post-surgical care is very simple. We have a small incision. They have to keep it dry. They should basically not get it wet, or if they get it wet, they need to dry it, put a new dressing on it. They should not exercise strenuously for 6 weeks, but that's pretty much it. So this was the original study on which the FDA granted approval. And the way they get approval for these devices is by saying it is non-inferior to the devices that are already present in the market, hence it should be marketed. So this is one of the very few devices in which we have a 5-year follow-up. And basically they looked at physical function, the patient's symptoms, and the patient's satisfaction. And over 5 years, we had over 80% improvement in physical functions, symptom severity, and patient satisfaction of 90%. And this is unprecedented for any device that I've seen come in the market in the past several years since I've been a physician. So again, it is basically a small incision. It is reversible, doesn't require anesthesia. It's a day surgery. You come in, you get it done. And typically the effects are almost immediate. A lot of the patients get up off the table, they start walking, and they notice a difference. The first patient I did wanted to go fishing. That's why he got it done. And although we warned him not to, he went fishing the first week. So it is fairly amazing. It is fairly incredible. Thank you. Thank you.